This is a Jet 24, Fox 66, your Erie.com special report.
Good afternoon, I'm Brian Wilk. We interrupt our programming to bring you a special report, an update on the spread of COVID-19 in Erie County. We go live to the studios of WQLN TV. Here is Erie County Executive Kathy Dahlkemper.
Good afternoon, and thank you for joining me today as we talk about COVID-19 here in Erie County. It is an absolutely beautiful day here in Erie County, so I wish that I had good news to share with you. But as we suspected, with the weather warming up last weekend, and with the governor's announcement that Erie County is permitted to shift into the yellow phase tomorrow, the announcement that was made a week ago, it appears that people in Erie County have rushed back into the old normal, gathering in groups, not keeping social distance, and not wearing masks. And so today, we have 9 cases of COVID-19 to report here in Erie County. That is the largest number we've had a report in a single day. 3 of the cases are in their 20s, 2 are in their 30s, 2 are in their 40s, 1 in their 50s, and 1 is a teenager. 3 of the new cases are located in Zone 1. 2 are located in Zone 2. 1 is located in Zone 3, and 3 are located in Zone 5. And you will find these on the cumulative cases map by zone at eriecountypa.gov, and of course on your screen right now. As you can see, these cases come from all over Erie County, from Girard to Northeast, from the Enboro area to the city of Erie and Mill Creek. Our total of cumulative cases is now 104 positives, with 2,439 negatives, and 79 have recovered. As always, our contact tracing continues at the Erie County Department of Health, and right now, every single person who does contact tracing is working on these 9 new cases. Crawford County has 20 cases. McKean is reporting 6 cases and 1 death, and Warren still stands at 1 case. Chautauqua County has 38 cases and 4 deaths, and Ashtabula now has 169 cases and 18 deaths. The state total stands at 52,915 positive cases, 3,416 deaths. Erie County residents, I am deeply, deeply concerned. And I believe that you should be deeply concerned too. You or someone you love could be the next host for this virus. And if people are not following guidelines, these numbers are just going to continue to rise. So I am begging you, as we prepare to reopen our businesses tomorrow, as we move out of the stay-at-home order into the yellow phase, please continue to take the necessary precautions. These same precautions that I and Secretary Levine have been discussing and sharing with you every single day for weeks and weeks, that have enabled us to maintain a reasonably low number of cases so far here in Erie County. And again, I realize how difficult it is to change habits and to create new habits. After all, we've worked our entire life and gotten used to a lifestyle that we like. And I'm asking you just to make these few minor but really important adjustments. We know this is temporary, this doesn't last forever, but we don't have an end date either on this. So we simply do not have a vaccine or really a lot of excellent treatment for COVID-19. So please, keep your 6-foot distance from all of those people that you come in contact who don't live in your home. Please continue to wash your hands often during the day for at least 20 seconds with soap and water. And please continue to take all surfaces and sanitize them. And wear a mask when you have to leave the house for any life-sustaining reason, or when you're near other people, if you're at home, or even in your yard as someone's walking by. wear a mask, protect that person, and ask them to wear a mask to protect you. Many people have called the Erie County Department of Health to see if we could have a mask for them. We are not currently able to provide those masks to individuals, but masks are being distributed through a network of our community partners. However, it's really very easy to make your own mask, and we have instructions on how to do that on our website. You can even make a mask out of a t-shirt. No sewing, just a pair of scissors is all you need. And those instructions can be found under the Community Health Interest page at eriecountypa.gov. Our environmental team is very, very busy out there making field visits, answering questions that our businesses have asked about, truly assisting our businesses as they begin to reopen in Erie County tomorrow. We received and posted an updated list of businesses and activities that are permitted to operate as of Friday, May 8th. And we received a very good fact sheet from the state today, a new life-sustaining business FAQ document, which has also been uploaded under the business resources at eriecountypa.gov. It's truly an excellent resource, gives us much of the guidelines on things that we were asking about. And as more information becomes available, we will continue to talk about it here, and we'll continue to post it on our website and communicate it in any way we can to you. Our #1 priority is the health and safety of our community. And so we are urging our businesses, as you do open, to do your best to comply with the guidance. And we're asking every one of you to adhere to those guidelines as you go out back into our businesses here in Erie County. And now today, I am really grateful and to welcome 4 really important people in our community, those who lead our great health institutions here. And they will each have a moment to talk. We will have it with us today, Dr. Christopher Clark, who is the President and Chief Executive of Allegheny Health Network, St. Vincent Hospital. We have David Gibbons, who is the President of UPMC Hammett. We have John Gennaro, who is the CEO and Director of the Erie Veterans Administration Medical Center. And we have Mary Eckert, the President and Chief Executive Officer of LECOM Health, Mill Creek Community Hospital. These important people have taken time out of their day to come and speak to you today, and I am grateful for that. And we'll start today with Dr. Clark from Allegheny Health Network, St. Vincent. Dr. Clark?
Good afternoon. Could you hear me okay?
Yes, we can.
Oh, you can hear me?
Yes.
Okay. So thank you, Kathy, for the opportunity. Things are going well at AHN St. Vincent. We continue to test patients for COVID disease by physician order at one of 2 locations, the hospital and the tent testing site outside the Westside Health and Wellness Pavilion in Mill Creek. To date, we have tested over 1,100 patients, with 44 coming back positive. And right now, we do not have any patients in the hospital with COVID disease. This week, AHN St. Vincent returned to performing elective surgeries in our main operating room and in the St. Vincent Surgery Center. This transition has gone very smoothly. We perform extensive screening of our patients as a part of the process, and our facilities are safe and clean. As a reminder, any care delivered to COVID patients is done separately from all other patients in the emergency room and in the hospital. We're also pleased to report that we were able to reduce our number of isolated inpatient units for COVID patients to just 1. Everyone at all of our sites continues to wear masks, and we are limiting visitors unless there are special circumstances. We also screen and mask all our patients that enter into our facilities. Next week, we will begin to perform screening procedures and more diagnostic tests that were previously postponed. In-person care in our outpatient practices is slowly resuming, although telehealth visits are still a very good option. Please note that all of our locations have implemented social distancing practices and other safety measures. That all being said, like Kathy was saying, I do want to take this opportunity to reemphasize the importance of everyone's role in preventing the spread of COVID-19. Even though Erie County has achieved this milestone of the yellow phase and the relaxation of the shelter-in-place order, everybody has the responsibility to protect one another. I still advise that you think twice before you leave your home. And if you do leave, please wear a mask to protect others. Avoid congregating in groups. In regards to this weekend, I want to wish all the mothers, including my own mom and moms-to-be, a wonderful Mother's Day. But please consider the use of technology to connect with one another this Sunday. The best gift that you can give to your mother is her safety. Also, I think most people know it's Nurses Week across the country, and next week is actually Hospital Week. I want to acknowledge all the great work that has been done by so many of our caregivers in all the hospitals in this community in regards to preparing for and treating COVID patients. They truly are heroes. Thanks for the opportunity to speak, Kathy, and thank you for your team, you and your team's leadership in this community.
Thank you so much, Dr. Clark, and thank you for the great partner you've been throughout this entire time. Next, I'd like to ask Mr. David Gibbons, who's the president of UPMC Hammett, to speak. David?
Good afternoon. Can you hear me, Kathy?
I can. Thank you.
Yes. Thank you for inviting us once again to be part of this important briefing to the Erie community. On behalf of UPMC Hammett, I really want to thank our community certainly for their willingness to mask and social distance. These efforts have helped us protect our healthcare workers and others that are essential providers to the community. And we've successfully made it to the yellow phase, and a part due to these efforts. UPMC remains ready to give safe care no matter what curve exists. We have enough ventilators and protective equipment and beds, and we have plans ready to move effectively should we see increasing numbers of COVID-19 positive patients requiring hospitalization. Last week, Pennsylvania announced that hospitals like UPMC Hammett could resume not just essential care, but also preventative and elective care. And we are testing symptomatic patients and high-risk asymptomatic patients that present for care with the goal of increasing testing in the future. As always, we want to focus our care on the patients in a safe way, and therefore we've developed processes to ensure patients as well as staff are safe. We do this by testing patients, as I just mentioned, with a focus really on the most vulnerable. Particularly notable are the elderly. Thoughtful visitation and entry screening policies, continued vigilance over our personal protective equipment, contact tracing for any new COVID-19 cases in our patients and employees, maintaining specialized units within our hospital dedicated to COVID-19 care, continuing to provide information to our public health partners to guide decisions outside of our walls. And we've all learned a lot about this virus in the last 2 months. To continue to be safe, we strongly urge everyone during this yellow phase to follow the CDC guidelines for protecting yourself and others. And just as Dr. Clark said, we want you to wash your hands often. We want you to avoid close contact, practice social distancing, cover your mouth and nose with a cloth face cover. And it's important to repeat that message. Your nose and your mouth must be covered when around others. If you cough or sneeze, make certain you cover that cough or sneeze. Clean and disinfect your hands and the environment. Also, if you are sick, stay home. Do not go to work. Do not interact with others. Stay home, self-quarantine. With these simple public health measures, society can return to a new normal. And as always, I wish our nurses happy Nurses Week. We have Hospital Week next week. We are practicing and celebrating those virtually right now. And as Dr. Clark mentioned, we have Mother's Day celebration. So we wish everyone a happy Mother's Day. Practice social distancing. If your mother is elderly, please be very, very careful when you interact. Limit the number of interactions that you have. And if at all possible, I encourage you to make a virtual visit. I'm certain that my colleagues here today will attest. We want everyone to remain safe. We wish everyone a very happy and safe Mother's Day. And Kathy, thank you for this opportunity.
Thank you very much, David, again, for your partnership also. We have now John Gennaro from the Erie VA Medical Center. John?
And I'm pleased to join you today. I want to first recognize our nurses who care for the most vulnerable, provide reassurance amidst uncertainty, and bring hope that things will get better. Thank you for your perseverance during this unprecedented time. As the county begins to reopen, I want everyone to know the safety of our veterans and employees continues to be our top priority. I want to assure veterans they can continue to trust the Erie VA for safe, high-quality care. We are encouraging social distancing by caring for veterans through virtual visits. Veterans have provided positive feedback that virtual care is efficient, easy, and an effective way to meet their healthcare needs. Additionally, veterans who have urgent and time-sensitive needs continue to be seen face-to-face, should their provider feel it's medically necessary. We ask veterans experiencing any cold or COVID symptoms to call our nurse line at 814-868-8661 and press 3. The nurse line will provide veterans with an appropriate screening and follow-up instructions. Again, for the safety of our veterans and our employees, please call the line prior to visiting the facility. For the community, let's continue to do our part and follow the safety guidelines outlined, including physical distancing and masking while in public. I want to thank our employees and veterans for their strict adherence to the safety guidelines. Finally, the planning for further service is underway with our team and will be conducted in concert with the National VA Strategy. We want to assure that our veterans are safe. And of course, happy Mother's Day to my mom, my wife, and all the other moms out there. Thank you.
Thank you, John, and thank you for, we're so grateful to have such a great VA medical center here in Erie County to serve our veterans, so thank you for what you do for them every single day. And lastly, Mary Eckert, who is with LECOM Health, and she will speak to us next. So Mary, please.
Thank you, Kathy, for the opportunity, and thank you for all that you're doing in the community to help with this this pandemic. At Mill Creek Community Hospital, as of 8 a.m. this morning, we had tested a total of 156. We have 143 results back. 134 of those have been negative. We've had 9 positives. 2 of those positives required inpatient care. The rest were outpatient. So we're very glad to also say that we've reduced our COVID number of beds. We started with 9, and we're now down to 4 beds. So I think that I think we're all on the right track. I want to reiterate the fact that I believe all hospitals are safe. Everyone who enters Mill Creek Community Hospital is screened upon entering. Temperatures are taken. Questions are answered regarding possible symptoms, and everyone is masked. Strict infection control procedures are in place, and intensified cleaning is happening throughout the hospital hourly and daily. We maintain social distancing and practice that throughout the facility. Hand sanitizers are available at every turn, and we encourage, obviously, frequent hand washing. We've limited our entrances, and that keeps the foot traffic down and helps us to maintain fewer people in the hospital. We also started on Monday to do some elective surgeries, and again, adhering to the strictest of infection control policies. I want to reiterate the importance, especially this weekend and tomorrow as things begin to open up, the importance of masking, social distancing, and hand washing. I'm cautiously optimistic that Erie will adhere to these. I'm surprised and I'm disappointed with your announcement that there were 9 new cases. I was just speaking earlier that I think we went 2 days without any, and that certainly was something to be excited about. So was not happy to hear that. I want to thank all healthcare workers in Erie County. They're truly the heroes in this fight, and we wouldn't be where we are today without them. Again, all mothers, happy Mother's Day, and again, thank you all.
Thank you, Mary, and thank you for being such a great partner also. We have great healthcare facilities here in Erie County. We are very, very blessed to have 5 hospitals within our region serving different populations, and I'm just grateful, and I'm grateful for the 4 of you for taking some time today to be on here to give this really important message to our community as we move into the yellow phase. And with that, we're going to start taking questions from the media, and you have questions for any of our guests or myself, and we'll start today with Talk Erie.
Yes, good afternoon. I have a question for the healthcare providers. Over several days, the Pennsylvania Secretary of Health has been encouraging those with opioid addiction to continue to seek treatment during the crisis. Now, these extraordinary announcements have been alarming members of my audience who are asking if you've seen a rise of overdose cases and or deaths in your emergency departments, or some additional or rising use of Narcan. Can anybody speak to that?
Well, Mary Eckert, we have a large VH population. We have not had any high increase in deaths. I can't speak to the Narcan, whether that's on the rise or not. We've maintained a steady volume, but nothing out of the ordinary.
This is David Gibbons, and like Mary, the same. We really haven't seen an increase at all. What I can share with you is our Safe Harbor, our outpatient behavioral health program, has remained in very close contact with their patients. And again, I'm happy to report that we have not seen a spike in Narcan utilization or in overdosages or a rise in emergency department visits resulting from opioid use.
This is Chris Clark. This is Chris Clark from St. Vincent, and I know John just said that too, so I agree with what's been said. Now, it's something to watch out for, though, too. So the question is a very, very good one, and I think it's worthwhile that we, over time, actually look at the data to determine if what we're all, at least anecdotally, saying is true.
Yeah, and I agree with all the comments, and likewise, we haven't never seen that uptick. However, our behavioral health providers, our social work staff remains very engaged with our staff, making proactive calls to the veterans, and in fact, encourage any veteran in help, please give us a call.
Thank you.
And I'll just reiterate that in Erie County, we have excellent behavioral health services. We are very, very fortunate that we have as many and robust services as we do, obviously mentioned by many of those who are with us today. So I have not heard of any uptick through my Department of Drug and Alcohol, but I will say I have read some things in other communities, not only in Pennsylvania, but even Erie County, New York. I saw something this morning. So it's something we all need to be aware of and watching for, and certainly assisting those who are struggling with addiction. Erie News Now.
I have a question for you. Just how concerning is it that we're 9 hours, I guess, away from entering the yellow phase at this point, less than that, and as we are just a matter of hours away, we get our biggest spike in cases?
So it's very concerning, and I've been talking about this all week, even since last weekend. Last Friday when we made the announcement, or when the governor first made the announcement, we were going to yellow, and I think people just right away thought, well, red is lifted and we're out and about, and you can see that even in the traffic, I think, as you drive around the community. You certainly see it in the number of people that are out and about. We saw a bump, if you remember, shortly after the Passover Easter holidays, when we knew people had probably gotten together. Now we're seeing a bump, a significant bump after a beautiful weekend where people heard that we were moving to the yellow phase. And also this bump is showing that it was all over the county. It wasn't just limited to one area, because we'd been having a number of cases coming in from just Zone 1, the city of Erie, but now these are from all over. And so, the caution here is that we cannot relax on these guidelines. We can get out more, we can go shopping a little bit, but if you don't feel safe somewhere, I've said this over and over again, then don't go in. You need to be taking care of your own health and those that you care about. So keep yourself in a safe situation no matter what, and follow the guidelines we've all spoken of today.
And how worrisome is it that we have these 9 cases, and even though contact tracers are all going all out on these 9 cases, realistically they're probably not going to get a hold of everybody that these people were in contact with today, and then those people have the yellow light, as it were, to go out into the community tomorrow.
So the faster we can get to these cases and get to their contacts, obviously, the better. And we are doing the best we can, but I can tell you right now we're pretty much working at capacity. And so if we have more cases come in the next few hours, or late this evening, early tomorrow, that will really tax the staff in terms of what you're talking about, and that's quick reaction and getting to these individuals. So all very concerning. I will tell you that we have posted our 2 different per diem jobs around contact tracing. They're on the careers page on the Erie County PA .gov website, and they've just been up there in like the last hour and a half. And they are a per diem public health call center representative and a per diem disease investigator. So if you want to look at those job descriptions and you're somebody who wants to help out, we really do need to build up those numbers, and we're talking about 18 people that we would bring on and try to train to be able to do this work as we see numbers like this. Jet TV.
Hi, Kathy. It's Samir. So my question, obviously we're 9 hours, or give or take, whatever we are, from entering the yellow phase, and we've gone on record and you've stated that we could possibly see a double or tripling of our case numbers. So is it really that surprising to have this many?
Well, we didn't go to yellow yet. We go to yellow tomorrow. But as I said, I think over the last week, people have just acted like we were already in yellow, and the only difference is tomorrow you're going to see businesses open, which is going to bring more people out. And so I actually have to say, when I was told there was 9 today, it was a gasp. I was really not expecting to see 9 cases this quickly, but then I thought about last weekend, and I thought about the observations I made myself and others made, and you just put 2 and 2 together, and there's your answer with how this happens.
Then I guess whenever we do move into that yellow phase, is this going to be, I guess, surprising seeing that amount of cases, let's say, mid-next week?
So if we continue on these numbers, we will get close to what we call that state number of 50 cases per 100,000 over a 14-day period. And then if we get to that, we have a very high risk of going back into the red phase and closing everything back down again, which I think would be devastating to some of our businesses who are working hard to ramp up and open up tomorrow or within the next few days. We don't want to do that. And then, of course, we have our 4 healthcare facilities joining us with today, and they have been ready for a surge in the hospital, but they don't want to see that surge, and I'm sure they would all agree with me on that. The last thing we want is to see people in the hospital struggling with the effects of COVID-19. So it's going to be imperative that we all do our best to protect each other, and particularly to protect the most vulnerable. I've said this for a long time. We have skewed younger on our numbers in this community in terms of those who have gotten COVID-19. That's probably one of the reasons why we've only seen 2 deaths, while we've seen just really not a lot of people in the hospital, and those who even went in the hospital, sometimes not the most severe cases that you've seen in other, we see on the nightly news, for example. But those younger people in their 20s, 30s, 40s, 50s, they all have older relatives that they might go see. And if you don't know you have COVID-19 and 25% of the people don't have the symptoms, that's how you can spread it to that elderly person who then unfortunately could become that very sick person and potentially even die. Not to say that younger people can't get very sick and die too, because we've seen that, but it's much more concerning in the elderly population. So that's the concern, and that's what I ask everyone to think about as you go out and about. Erie Times News?
Yes, Kathy, it's David. Just getting back to the 9 cases, have your disease investigators, your contact tracers, told you unequivocally that a number of these cases are traced back to last weekend? I know it's anywhere from a 2 to a 14-day window that folks can have this. It certainly seems to make sense that it would be last weekend, but have you gotten confirmation that some or all of these cases are from last weekend?
No, I haven't actually. I don't, and I'm making a lot of assumptions there. It just seems like that may be a correlation, but they have been so busy today that they haven't been able to give me much information on these 9 people and where they may have contracted the disease. But We do know that they're all over the county. It's a much different scenario than we've been talking about even in the last week or so, where they've been much more concentrated in one zone.
And I just want to follow up. We've passed the 100 case barrier number. What are your thoughts on that? Obviously, 100 cases is a lot, but I would imagine 3 weeks ago you were concerned that we would see 100 cases a lot sooner than we have. What are your thoughts on reaching that level of cases in the county?
Well, I would have rather been staying down in the 40s and 50s, but obviously I didn't think that was going to happen. So 100 is a big number, not as big as other places. I did look on the state site again, and I think we still are at number 31 in terms of cases of all the counties in the state, with being, depending on which site you look at, either number 14 or number 15 in population. So we're doing a lot better than many other counties who are larger than us. But we want to continue to keep our numbers low so that our healthcare partners here don't get overwhelmed and that we don't lose any more lives. And that's what this is all about, is saving lives. Is there any other media outlet with us today that would like to ask a question? Hearing none, we'll go back to Talk Erie.
Kathy, I want to stay on this cases here. You may not know this, but I keep track. I have my own charts and graphs. And with this new 9 cases, it puts us at 104, which means that we've had 13.3 cases per 100,000 in population over the last 14 days. That's a big difference from the 50 cutoff there. As a matter of fact, it's actually much better from where we were just a week ago, which on the 30th, we were at 15.2 cases per 100,000 for the previous 14 days. And the day before that, on Thursday or Wednesday, we were at 16.7 last week. So we're actually trending down. And I guess I would like you to respond to this data and ask why you're not getting this kind of granular data from your health department.
You know, I'm not saying I'm not getting data. I'm just saying that we're concerned that our numbers are going to double, potentially triple, potentially quadruple. We don't know that for sure, but if people get careless and don't follow the guidelines, that's what we're going to see. So, you know, my staff can give me whatever statistics I want, whatever granular data, and we're looking at all this. We've gotten nowhere close anytime during this entire period of being close to 50 cases per 100,000 over 14 days, and we know that. So we're in a good place. But if a trend starts happening where we start to see larger and larger numbers, we're going to get closer to that number. So we'll see what tomorrow brings, and the day after that, and the day after that. We'll see where we are 14 days from now, and that will really help us. And I hope that our numbers continue low, and I hope our numbers continue to trend down like you're talking about. That would be the best scenario, and I hope that that is the scenario we see in Erie County. And again, it's really up to the residents. It's up to the businesses. If we all do our part, I think we'll be there. But I also...
Quick follow-up.
Okay, go ahead. Mm-hmm.
I'm sorry.
Go ahead.
No, I just didn't know if your staff told you that if any of these cases were from the LabCorp data dump that Dr. Rachel Levine referred to today.
I'm sorry, from the what?
Like
I didn't hear Dr. Levine's press conference, so I'm not sure what she said. Can you repeat that?
She was saying something about a LabCorp data dump.
LabCorp data. I'm not sure. Yeah. I can't speak to that because I didn't listen to her press conference today. I was on another conference call, so I don't know what you're talking about, but I'll try to find out.
Thank you.
Sure. Jet TV.
Can you hear me?
I can.
Hello? Yeah, it's Samir. So back to the contact tracing, I guess, how has this had an impact on the tracers? Obviously, this is our biggest spike in numbers.
So the people who do this kind of work have been on call, working day after day. We've tried to get, we had some lulls in there, so we try to get them some days off. And again, we don't have extra staff right now, so we need to get some more people trained up so that we can obviously give people days off and give them a rest and a break from all this. So it hasn't been too bad. Today's a different day. Today is a day when everybody's really full out doing this kind of work, and it's difficult. It's difficult work, but They're all very good at their work, and I would say they enjoy their work. They feel like they're making a difference in our community.
Well, I guess I was asking more along the lines, are they, is this kind of getting to where we do need to bring in more contact tracers? Obviously, you guys are starting to hire more. I apologize if you've already set a number for how many you're planning on hiring, but how many extra contact tracers do you think the county will be hiring?
We're looking at 18 new positions between those two positions. One group will be healthcare call center representatives. Will be more of the calling piece, and then the others will be the investigators, which are the ones who really have to dig in and get that information from each one of those new positive cases. So we have two different positions, and the job descriptions are online.
Thanks.
Erie News Now.
Hi, a question for our healthcare providers. We're looking at 9 cases today. What sort of a daily rate over, say, a week, a daily caseload per over the course of a week, would you look at? What would it have to get to before you'd start to sweat a little bit, before you say, maybe we need to back this down a little bit? So capacity-wise, where are we looking before we start worrying a little?
This is Chris Clark from St. Vincent. I really can't give you an exact number. I certainly would expect it to be much higher than what was reported today. It clearly relates to a lot of variables that which are tied to capacity and staffing and to some degree equipment. But I think all of the hospitals in the community are doing well with equipment. We're in a situation, I already mentioned that we've reduced our number of isolated units for COVID patients to 1. With a certain bed capacity, we can ramp that up to 3 or 4 separate units if we needed to. So we're a ways away. We don't want that to happen by any means, but it's been mentioned that all of the hospitals have been spending this time over many weeks preparing for a surge. And so, and the other way I can answer it is looking back, we report our numbers on Fridays on a weekly basis, and we would, it's still a day away, but we have had 5 cases in the last 6 days, which is, again, a manageable number.
This is David, and I will share with you, I have executive oversight of 7 hospitals: Jameson, Horizon, Northwest, Chautauqua, Kane, Hammett, and we have no COVID positive inpatients in our northern pod of hospitals. And in Erie, like Dr. Clark said, we have ample space within UPMC Hammett. Our COVID units are, we don't have COVID patients in there right now, so we have adequate capacity given the low demand to meet the needs. So that's why I think it's important that we continue the hospital presidents that are on this call today and a few others from surrounding hospitals. We meet on a regular basis. We share our capacity, our PPE numbers, et cetera, with each other. So we are working very collaboratively together, and obviously with County Executive Dahlkemper. So the good news is that these patients that are COVID positive, these individuals, are really requiring significant hospitalizations. And I think that's one of the key messages to share with the community today. But I would also add that the practices that we are advocating today as we move to the yellow zone protect you, the community members. But why we are here today is to protect our healthcare workers, because practicing and adhering to these guidelines is very important to each of us so that we have staff present and available to care for the community.
Would anyone else like to speak to that?
Oh, Kathy, this is Mary Eckert. I just want to say that over the course of the beginning of COVID, we have only had 2 inpatients, and we were geared up to be able to handle up to 9. I think the community is fortunate that we have not had the severity of cases that other large cities have experienced, and I believe that we are all the community is well prepared in the event that there would be a surge. I hope we don't have that, but I think we're prepared in the event that that would happen.
And likewise for the VA, we work closely with our community partners, David and Dr. Clark, along with other 8 counties. So we have working relationships with all those community hospitals for any veterans who may need inpatient care related to COVID. And so we're confident that the resources are available and can be available.
Thank you. Erie Times News.
Yes, Kathy, want to see if you've gotten any clarifications on some of the other businesses and activities that might reopen since yesterday. I know you were looking for some more on summer camps. Also want to see if you've gotten anything on playgrounds, basketball and tennis courts, or parks.
So we got a lot of guidelines today. It's actually now posted on our website, and it's under our business resources. It's a 16-page document that I got. Lots of good information here about playgrounds staying closed, all organized outdoor sports not happening this summer. So there's still some questions we have, and the camp thing is not quite, I don't think, laid out clearly in this document, but we are working to continue to get more answers, but we feel very grateful that we got as much as we did today. So under number 4 on this, you'll see it says what types of businesses fall under indoor recreation and outdoor and entertainment. So there's a lot in here, and I would suggest that all of those listening and viewing this today could get on our website, eriecountypa.gov. Under the business resources, you can find this, and it's also on the state's website, and we can certainly answer any specific questions if you need to, but you can call the Health Department if you can't find it online, 451-6700. So please make sure that you look at that, because it is a very good guideline that came out to something that we had been looking for, so we're grateful for that.
All right, thank you.
Sure. So one of the things I want to just mention as we talk about this, and I'll just tell you, these are the kind of things that concern me. When we talk, our numbers are still fairly low, and we hope they stay low. But if people move around a lot more, we're going to see more cases rise. We actually, one business told me today that they've had 5 phone calls from different people in Philadelphia wanting to come to Erie County to get something done up here that they can't get done right now in Philadelphia because of the closure of them being in the red zone. And Philadelphia is obviously quite a drive to come to Erie to do something. And so these are the concerns we have going forward, that we may see people coming here from the red zones. Philadelphia is obviously the county that's got the most cases and the most deaths, obviously the largest county by far in Pennsylvania, but the east side of the state has had a lot more issues than we've had here in the west. And those are the kind of things that concern us going forward. Will people come here to shop because their stores aren't open yet down in the southwest, for example? And so be cautious as you're out and about. You don't know who's carrying COVID-19, and we just ask everyone to take every precaution you can to keep yourself and your family safe. And so we've gone for about 45 minutes now, and I think that's probably plenty for me to keep everyone on this call today. So I thank again our 4 partners here in our great health facilities, and thank you for your time out of your day. You do great work, and we are so, so grateful for that work every single day. So we're going to continue to do these press briefings Monday through Friday at this point. We will not have one this Saturday, just as a reminder to everyone listening. And lastly, I just ask you all to please stay home as much as you can when you're out. Please stay safe, wear a mask, and please stay calm throughout this pandemic. Thank you.
You've been watching today's update on COVID-19 from County Executive Kathy Dahlkemper. In case you just joined us, here are some highlights of the update. We have 9 new cases of COVID-19 in Erie County. That's the most cases that the county has had in a single day. And we heard the county executive mention that as the weather has been warming up and as we head into the yellow phase, some people have not been following the right guidelines of social distancing and wearing a mask. And she said that she's deeply deeply concerned. She even mentioned that she's begging people that even in the yellow phase, people should still continue to social distance and wear a mask. And of these 9 new cases, 3 are in their 20s, 2 in their 30s, 2 in their 40s, 1 person is in their 50s, and 1 person is in their teenager. And these cases, they are spread out all over the county. So as of this afternoon, here are the latest on the confirmed cases of coronavirus near us. The Pennsylvania Department of Health releasing the latest COVID-19 cases for the state. Now, across the Commonwealth, there are now nearly 53,000 positive cases of COVID-19. There are now over 3,400 reported deaths, but nearly 210,000 people have tested negative. Here in Erie County, the state's website shows a total of 101 confirmed cases of COVID-19, but we heard the county executives say that there's 104. So that's 9 new cases, and we have 2 deaths in our county. Crawford has 20 cases. Warren County remains at 1 case. There are 38 confirmed cases reported in Chautauqua County, New York, and 4 deaths, and 165 confirmed cases in Ashtabula County, Ohio, with 17 deaths. So what should you do? The best advice: stay calm, stay home, and wash your hands often. Plus, practice social distancing and wear a mask. And Jet 24 carries a live, digital exclusive coronavirus newscast daily at 11:30 a.m. and 3 p.m. on our website, yourerie.com. And we'll have a complete wrap-up tonight on Jet 24 beginning at 5, and we are live every night at 7 p.m. on Facebook. Thank you for joining us. Good afternoon.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to yourerie.com. We now return you to your regularly scheduled programming.